The aim of this video is to give you more information about radiotherapy treatment for breast cancer at the Northern Radiotherapy Network. Whether you are coming for radiotherapy in Middlesbrough, Carlisle or Newcastle, the treatment you receive will be standardised as far as possible across our network. It is just the location and the setting that will be different. The information in the video covers what is involved in the treatment, including aims and side effects, as well as the benefits and risks of any alternative treatments, including no treatment. It will help you decide whether you wish to go ahead with the treatment, and you will have an opportunity to discuss any questions or concerns with your clinician.
The vast majority of patients that we see, their breast cancer is caught early. They have fantastic surgical care and sometimes preoperative chemotherapy, and the vast majority are cured of their breast cancer. We hope that the radiotherapy contributes to that, and as a team we aim to give patients the highest possible cure rate that we can by utilising all these treatments, the surgery, the chemotherapy, the hormone therapy, the radiotherapy. All of these add up together to give patients the best outcome.
What is radiotherapy? Radiotherapy is the treatment of cancer using high energy X-rays. Radiotherapy for primary breast cancer is given after surgery to destroy any cancer cells that may be left behind in the breast and surrounding area. This is called adjuvant radiotherapy. If you've had breast conserving surgery, you may have radiotherapy to the remaining breast tissue on that side. This is called whole breast radiation. Not everyone who has breast conserving surgery will need radiotherapy. If you've had surgery to remove your breast, you may still need radiotherapy to the chest wall, or you may have radiotherapy to the areas where the breast cancer was. This is called partial breast radiation. You may also be given radiotherapy to the lymph nodes under the arms to destroy any cancer cells that may be present there. It may also be given to the lymph nodes in the lower parts of the neck, around the collarbone, or in the area near the breastbone. If radiotherapy is recommended for the lymph nodes, your specialist will explain why. Some patients will be asked to hold their breath during their treatment. You will be advised of this during your consultation.
So after you've had your surgery, everything has been removed, and we know that radiotherapy can reduce the risk of the cancer coming back into the breast, and that's the reason why we do it. And we do treat, as a rule, the whole of the breast in case there are any stray cells somewhere within there, and we can just kill them off with the radiation.
Planning a course of radiotherapy is very important because it ensures each treatment is given accurately. Your treatment is planned by a team of radiographers and dosimetrists under the supervision of your consultant. The planning scan involves the use of a CT scanner to identify where we need to treat. A CT scanner is a donut-shaped X-ray machine which is used to take pictures that the team use to plan your treatment accurately and to target the area that needs to be treated. This procedure takes about 15 minutes and is completely painless. The therapeutic radiographers will have checked the referral from your doctor, and they will also ask you to confirm your consent.
The planning scan takes about half an hour in total, but most of that time is getting the patient in the right position. So for the scan, we would ask people to take off their top things to the waist, and they're given a gown to put on. For the breast cancer treatment, we need generally both arms above the head, and there is some special kit that we use to support them in that position. The radiographers are in the scanning room all the time. They will reassure and chat to people, answer any questions. When they come to do the planning procedures, it's important that people keep really still. So generally, it's better if you wear something where you have some trousers or a skirt, and then you can just take the top part of your clothes off. So you can eat and drink as normal, that's not a problem. You're probably better off leaving off any jewellery because we will need to take that off for the CT scan.
If you have a pacemaker or implantable cardioverter defibrillator, or if you think you may be pregnant, tell your specialist therapeutic radiographer before or during your planning scan. During the scan, you will need to lie in the same position you will be in for your radiotherapy. To ensure you are always in the correct position for every treatment session, we will make some permanent marks, the size of a pinpoint, on your skin. These tattoos show where we need to direct your treatment. Following your radiotherapy treatment, these tattoos can be removed by laser technology, if you so desire.
So when a patient attends for their planning scan, they will have to get undressed and they will have their arms up in the treatment position. The scan needs to be taken in that treatment position. During the process, the radiographers that are planning that treatment will actually have to draw some marks on the patient and also create some permanent tattoo dots as well. And this just allows the treatment to be reproducible when they come back for their treatment every day.
It is important that you've regained your arm movement after surgery. Before you start radiotherapy, you need to be able to comfortably raise your arm above your head. It can be painful or difficult to do after surgery, and if you need to improve the movement in your arm, please ask to see the physiotherapist, who can advise you on some exercises to help. A team of radiographers will treat you. You will be asked to lie on the treatment couch, and the radiographers will use the skin marks to position you in the right place under the treatment machine. Treatment times are usually very quick. You will be in and out of the room in about 10 to 15 minutes. Your partner or a friend can come with you and can sit outside during the treatment. Most of the time will be spent preparing you, like getting undressed and positioning you. You'll be asked to undress above the waist and you'll be given a gown to wear. The therapeutic radiographer will adjust the gown to expose the area to be treated. The treatment itself will only take a few minutes. You will feel no pain or discomfort. We ask you to breathe normally and to keep as still and relaxed as possible. You can play music during the treatment. This can be your choice and played into the room or through headphones. Most machines make a noise. This lets you know the treatment is taking place. You will be alone during your treatment, but the radiographers will be able to watch you and listen via an intercom and closed-circuit camera system.
So when you come in for your treatment, the radiographers will talk to you and explain exactly what's going to happen each day. You'll be taken into the treatment room and asked to change into your gown. When you actually have the treatment, we will need to expose that area, so you will be lying on a treatment couch in the treatment position without clothes on your top half. They will go outside the room and take some X-ray pictures to ensure that you are in exactly the right position before they deliver the treatment. If at any time you need them, you could wave your hand or shout and they would come straight in. So it's important to realise that you will be alone in the radiotherapy treatment room, but you are being watched on CCTV and you can communicate with the radiographers via the intercom should you need to.
Side effects of radiotherapy treatment for breast cancer usually build up slowly after you start your treatment. They may continue to get worse after treatment finishes, and then will gradually improve over the next few weeks. Your radiotherapy team will explain what to expect and how to manage any side effects. Please view our video on side effects for breast cancer for more detailed information.
Patients tell me the treatment is like having a simple X-ray done, so it is not an invasive treatment per se. It does target some of the deeper tissues. Again, that will depend on your type of cancer and you'll be advised of that, but it's not like chemotherapy treatment. You will not lose your hair when you're getting breast radiotherapy. For most patients, it doesn't make you feel sickly at all. For most patients, it is a superficial treatment with localized and relatively mild to moderate symptoms.
Following your treatment, your health professional will talk with you about what happens next. We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you are running late for your appointment, just let the department know, and please don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.